Hi everyone, welcome to session 6 of the online animal welfare conference of UFAW. My name is Siobhan Abbey-Singer. I am your chair for this session. Unfortunately, Joe Hockenhole couldn't make it. It is my pleasure to announce that the next talk will be our second plenary speaker of the conference, Professor Lars Chittka, who has done incredible work on bee sentience and bee cognition. So I'm really looking forward to this talk. Lars, take it away.
Hello, everyone. So my name's Lars Chittka. These here on the right are my co-authors for this presentation, and I've come to talk to you about insect sentience. Now, there is a traditional notion, I guess, that insects have only a kind of swarm intelligence, no individual intelligence, and let alone any kind of sentience. But that image, certainly about the intelligence, changes once you mark them individually with, for example, RFID chips, as we did in this image here. And what you realize instantly if you do that is that they have personalities, but also individual intelligence. And first of all, for those of you less familiar with daily challenges of bees, I want to explain a little bit what a bee naturally has to learn. So first of all, of course, bees are central place foragers. They have a hive, a home to which they must return without fail, because otherwise they die, or certainly their efforts are lost to the colony if they're social insects. So they have to have very good spatial memory, but they also have to be careful shoppers in the flower supermarket. That is, they have to, among the dozens of flower species that might occur in their flight range, find those that are most rewarding for the least effort, for the least cost, and then focus their foraging efforts on just those flower species that have the best cost to benefit ratio. And in doing that, they're associating signals, colors, scents, patterns to the rewards that they find in the flowers and leave other flowers to one side that they've come to realize are not rewarding. And this learning ability is something that, in a sense, we simply capitalize on in our learning experiments. So, for example, on the right here, you can see a honeybee about to land on a little platform with a drop of sugar solution, and in front of an image of a human face. And if she's done that a few times, she learns to recognize that image, and we can then do basically a crime witness test where we present the bees with a variety of different faces and ask her, well, can you now find the one, they're spatially shuffled now, can you find the one where you've previously been rewarded? Indeed, bees are very good at recognizing that image. And of course, this learning ability goes substantially beyond that. So here we have a string pulling task, a kind of intelligence test that's been designed for primates and corvid birds. And the idea here is you have an artificial flower, and you can only get to the reward in the center, the sugar droplet, if you pull out the string. And bees can learn such tasks just fine, even from each other. So what we have here is two bees. One is marked with a red dot. She's experienced with this task. She's done it a number of times before. And another individual that has never pulled strings for a reward in the past. And now you can see one's pulled a string, the other just scrounges on these efforts, and they're then sharing the reward. But you do that several times, and eventually the previously inexperienced individual will learn the task by herself through copying. She will do that even if she just observes this behavior from a distance. So now you can see they're getting a bit antsy because actually they've drunk up the nectar. The experienced bee now pulls the next string out. The other one is still faffing about by the old flower, but in a moment she'll run over to, again, scrounge on the rewards. But as I said, a few times, and the inexperienced individual will also start to pull a string all by herself. And you can even, after you've trained multiple bees in this kind of way, or they've learned it from each other, observe these sort of collective string pulling phenomena where it almost looks as if they're cooperating. We're still exploring whether indeed that is genuine cooperation. And these kinds of problem-solving strategies of bees and their social learning has actually been noticed by Jane Goodall. So I'll just play you a little clip. Hopefully you can all hear that.
The most recent example which blows people's minds is the bumblebee. And the bumblebee has been taught to roll a little ball. He rolls it backwards. He rolls the little ball until he can push it down, or maybe she, I don't know, into a hole, like a goal. And as soon as this little ball gets into the goal, the bumblebee is given a little drop of nectar as a reward. So they learn to do this. But the mind-blowing thing is other bumblebees who've merely watched a taught bumblebee can do the same without being taught, just by watching. And that is supposed to be a mark of very superior intelligence. So this is something we're learning all the time. We have been far too arrogant. The animal kingdom of which we are a part is filled with secrets. And gosh, I'd love to be young and learning about these things now, because all the doors are wide open and you never know what you're going to find.
Yeah, so this for me was very moving, because Jane Goodall was one of my heroines who actually got me interested in animal behavior in the first instance, and for her to recognize our work and say, hey, I'd like to be young now and study bees was quite something. So there's a lot of social intelligence then in the bees, but also, of course, we're interested in what they can learn and think about, in a sense, as individuals. And so one important question is in terms of the question of whether bees are conscious, and that includes the capacity to think as well as to feel. We'll come back to the feelings, the emotion side later. One question in this context is, can bees imagine things, objects? And they are obviously very good at recognizing flowers, but that can be done actually with quite simple feature detectors in the visual system, edge detectors, color detectors, and so on. It doesn't necessarily tell us that they actually store a little virtual image of a flower in their heads. But to explore that question, you can ask if they have the ability to recognize an object in different sensory modalities. So the question here is, can they recognize an object shape just by vision, just discriminating, for example, balls versus cubes, as in this image here? They can't touch the objects. They can only see them through a plexiglass lid. Once they've stored them like that, can they recognize them with a different sensory modality using their tactile sense in complete darkness? So in a sense, that is similar to sort of traditional children's birthday party game, where you would have to reach into a bag and not by seeing, but by feeling, finding something like a key or a spoon or a screwdriver or something like that. If you can do that, that means you can picture it in your head. And that's exactly what we did here. So we trained the bees, let's say, on balls to find a little reward, then tested the same bees in complete darkness under infrared light, and found that indeed they can recognize these shapes just using their tactile sense spontaneously without further training. And of course, you can do the reverse, as shown in this video clip here. You train them in darkness using their tactile sense. So here's a bee that's found a cube on which this bee has been rewarded. And we can then subsequently test the same bee in a setup where they can just see but not touch the objects in this case. So here's a bee now buzzing around the balls, inspecting them visually, rejecting it, and now landing on top of a cube. So bees indeed can picture things in their minds, so to speak. And now that you've seen all this work with involving balls, perhaps it's unsurprising that one of our students, Samadhi Galpayage, was actually interested in whether bees enjoy object manipulation, whether they play with objects by the same criteria that are generally used for object play in vertebrates, and indeed that turns out to be the case. So bees come back again and again to these balls, even if there are never any rewards involved with them, no appetitive rewards, that is. So they actually go out of their way to return to a chamber where they can roll balls around, as you can see here. And indeed, it turns out that young bees do this more than older bees. Male bees, perhaps unsurprisingly, do it more than female bees, this kind of play behavior. The males don't do any work for the colony, so they have a whole lot more time on their hands. But that brings us to the question, if they're enjoying this, if they're doing it just for the sake of the manipulation, then perhaps could these insects be said to have emotions? And that, of course, decades ago, certainly 20 years or 30 years ago, no one would have considered or taken this seriously. In fact, people might have been ridiculed for suggesting any such thing. And my perspective on this began to change a little bit when, about 15 years ago, we asked if bees can learn about predation threat. So one of the things that bees have to watch out for are crab spiders that lurk on flowers, as you can see in these images by Tommings. And they can also, like a chameleon, basically take on the flower on which they prey, at least some species. And we took that situation into the laboratory to basically ask, can they learn to avoid these predators? So we built these life-sized spider models paired with a solenoid-driven pincer mechanism that could briefly capture a bee and then release her, as if in an unsuccessful predation attempt. And whenever that happens, of course, there's an opportunity for the prey to learn something from the experience. And it turns out that the bees can learn to avoid this kind of threat. Their demeanor will subsequently change, so they will actively scan every flower before deciding whether or not to land on it. But the curious phenomenon is they display a lot of false alarms. That is, they reject flowers that are actually perfectly safe, as if they're seeing ghosts. And so the learning curves are shown here. You can see in this graph that with more and more experience, the bees make fewer and fewer errors. They make more errors when the spiders are cryptic. So if they're yellow spiders on yellow flowers, the bees make more errors, but overall they're improving a lot and there are very few errors. But the scanning behavior, if the bees know that they're looking for a cryptic target, is longer. They're scanning the flowers for longer if they know that spiders are hard to detect, that you can see here, even if they have to retrieve this information from memory. So if you look the next day, for example, you can still see that the scanning is much longer when they know they're looking for something cryptic. But the false alarms are the really perhaps most remarkable phenomenon, where the bees are responding to a threat that actually isn't there. They're scanning the flowers and then going, oh, this doesn't look quite right, and rejecting a flower that's perfectly good. And at least anthropomorphically speaking, this looked a bit like a kind of post-traumatic stress disorder. Now, this isn't yet a formal diagnosis of an emotion-like state, but at least it pointed in that direction. Now, bees, other insects, have a kind of reputation for not learning from adverse experiences and indeed showing no kind of self-protection. So you can see a few examples here where Eisenman, for example, and colleagues claim no example is known to us of an insect showing protective behavior towards injured body parts. Insects seem to have no pain-related behaviors. If an insect's leg is damaged, for example, it does not groom the limb afterwards. There are a few more here. The curious thing is that none of these authors have actually bothered to look, so they're just acting on or writing down their statements based on intuition, basically. And one of my students, Matilda Gibbons, has actually looked at this experimentally by briefly touching, not injuring, but briefly touching one of the antenna with a heated probe, 65 degrees. So this is again not injurious. It's actually colder than your cup of coffee, presumably. And then to see which of the two antennae the bee might subsequently groom. And so this bee's left antenna has been briefly touched, and you can see that she's clearly spending quite a bit of time grooming just that left antenna, not the other one, not any other body part. So clearly there is, as opposed to what everyone has been stating, a very directed grooming of the site that has been noxiously stimulated. You can see this graph here shows the extent of grooming on the stimulated side versus the non-stimulated side. There's a tiny bit of grooming if you just touch the antenna without any kind of heat, which is again site-specific. So at least that argument against pain, the claim that the observation that there's no grooming of an injured or noxiously stimulated site against the existence of pain, that argument falls apart right there. Now, another aspect of pain, it's not just the question of whether you can learn from noxious stimuli and respond to them in ways that are adaptive, is a hallmark of pain is a kind of flexibility. And in that way, it has to be distinguished from nociception. This, by the way, is from another team's work where they're studying bees' stinging responses to multi-electric shocks. And if the bee has registered the shock, it extends a stinger. So some of the work in this context takes place under these conditions, which presumably, at least to my mind, have the potential to be quite profoundly unpleasant to the bee. But the point there is that they're measuring a reflex here that supposedly, so many authors say, even if there is a response to a noxious stimulus, it's a kind of reflex. It's hardwired. Bee gets a shock, extends a stinger, and that's it. It's a hardwired response. And conversely, pain is not necessarily that directly linked to a noxious stimulus. Your response is plastic. So you might find that, for example, soldiers injured in battlefields might not actually sense their injuries until they're brought back to safety. And sometimes you might be made aware of a scratch on your knee by a friend after a hike in the wild, and you might then suddenly feel a painful stimulus after you've become conscious of the minor injury. So there is a flexibility that's a hallmark of pain, not nociception. And one way to probe this kind of flexibility is in so-called motivational trade-off experiments, where you can ask, does an animal really respond in a kind of hardwired manner to a noxious stimulus, or is there flexibility in trading off with other priorities? For example, can you escape from a burning building by pressing down a handle that's red hot to save your life? So you're gritting your teeth, you're suppressing your response to the unpleasant stimulus. And what we're seeing here is such a motivational trade-off experiment with bumblebees, where bees have a choice between two feeders, which in this case are yellow and pink, and you can see both have 40% nectar. This one is heated, this one isn't. Now, in such a case, the bees clearly prefer the non-heated version. So they reject this one, they land on it briefly and then immediately withdraw. So that's your reflex. They respond to the heated stimulus adversely, there's no question about it. Now, on the other hand, here on the right, you have a situation where we again have the heated stimulus on the left, and on the right side there's no heat. But in this case, the reward that the bees can get is very poorly concentrated. It's 10% only versus 40%. And in such a case, the bees are actually able to suppress their response to the heated stimulus and land there and get the goods and prioritize in this way the sugar solution that's of better quality and suppress their reflex-like response to the heat. And while this again isn't a formal proof of a pain-like response, it's at least consistent with it. We should recognize that a formal diagnosis of pain, of course, is not really doable in any animal other than the human, because humans can tell us about their experiences. So we have to collect lines of evidence from different paradigms, such as this one, such as the grooming one before, and the avoidance learning that we saw with the spiders, and take all of these together. But we by now have quite a good number of indicators that all point in the direction that indeed there are pain-like experiences in bees and quite possibly other insects. Now, one other hallmark of pain experiences as they're explored in other species relates to analgesia preference, relates to the question of whether an animal, when injured or when exposed to noxious stimuli, will seek out food that they know contains an analgesic in order to ameliorate the pain. And this has not yet been thoroughly explored in insects. There is a single study by Julia Groening and others with supposedly negative results. But the problem with that study is that they used morphine, and it's by now clear that indeed insects and other invertebrates do not have an endogenous opiate system. So one would not expect morphine to be an efficient medication to ameliorate the pain. So wrong drug. We need to try again, we or others, to identify substances that might actually do the trick, and if so, to see whether insects might self-administer them when that actually provides an advantage. There is some evidence from self-medication with other things, not in this case pain, but at least at this point in a similar direction, where we asked in this study whether bees self-medicate when they're parasitized by Critidia bombi, which is a parasite on in bumblebees, which resides in their guts and can make them very sick. And the evidence was a little mixed, but it was quite clear that, first of all, nicotine in the diet actually adversely affects the parasite. So you can see here at day 7, as well as at day 10, the control bees that were infected had higher loads of Critidia cells than did the bees with the nicotine diet. I should say nicotine is naturally available in a number of flowers, and bees indeed sometimes do seek out the nectar of such flowers, in this case perhaps to self-medicate. And if you then measure the preference of healthy bees versus infected bees for nicotine-laced nectar, then indeed it turns out that there is a preference not so much in the healthy bees, just a very moderate one, but close to 50-50, whereas in infected bees, they do have a preference for the nectar that makes them a bit healthier, although this could, of course, in theory at least, be a kind of innate response to self-medicate. So watch this space. I think there's more to be explored on this front. So one formal test of emotion-like states in other animals, domestic animals, but also laboratory rats, but also goats, dogs, when you're trying to find out, are they kept under conditions that are conducive to their well-being? There is basically a version of the the paradigm or the proverbial glass that in humans can be either half empty or half full. So the optimist would judge this situation as being, no, this looks pretty good, there's still a lot in there, and be quite content, whereas the pessimist will look at the same stimulus and say, this is actually, it's almost empty, and be all sad about it. And we adapted this paradigm for the world of bees to see how they would respond to such ambiguous stimuli, and if so, what kind of a state of mind that might indicate. So we trained the bees first to, for example, to associate in this little flight arena blue with a reward and green with not a reward. And they would always either find that blue is good and green isn't. And subsequently, after they've learned this, we're then asking, hey, how do you respond to the turquoise stimulus? How does this look to you? Is this either good or is it bad? And after the bees have been trained in this manner, they reliably fly to the blue stimulus without hesitation, straight line, and immediately land there. Whereas if we are showing them green, they know from experience there's nothing to be had there. They'll fly around for an extended period of time before making that decision to land. If nothing else is forthcoming, then in the end, after minutes of flight, they might land there. How do they respond to the ambiguous stimuli? So that's shown on the bottom here. So now we have turquoise, that's our glass 50% filled, and we want to know, well, how do you judge this ambiguous stimulus? And it turns out that the response depends on what happened to the bees before the test. So if we give the bees their positive stimulus, that's P on the left here, they respond very fast, without hesitation to land. The negative stimulus, green on the right, is shown here, almost 2 minutes on average before they land there. Here in between are our other stimuli, so M is the turquoise, the stimulus exactly in the middle. If the bees have had a little sugar droplet before the test, they will fly straight there. They fly at least much more straight than to the same stimulus if they've not had that reward. So that's the red curve here. The red curve are all the values for when the bees have had this little surprise reward. You can see for all the ambiguous stimuli, the response times are faster than black curve when they've not had that surprise reward. So the ambiguous stimulus, the same physical stimulus, is judged differently if the bees have had the surprise reward. It turns out that this optimism-like response is also dopamine dependent, as it is in us. And from Geraldine Wright's work and others, it also turns out that if you give the bees, instead of a reward, a surprise aversive stimulus, a surprise predator attack, the whole curve shifts in the opposite direction. The bees will then judge the ambiguous stimulus as more pessimistic. So at least by the same criteria that are used in vertebrates, the bee has positive and negative emotion-like biases that manifest to such ambiguous stimuli. So some conclusions. So there are several criteria that bees pass for pain-like experiences. There are responses that indicate long-term memories forming from adverse experiences. There are these false alarms that we're seeing when they've encountered crab spiders in the past. There are motivational trade-offs where bees trade off priorities relating to rewards and punishments, so to speak. We would like more evidence, of course, for the self-medication. There are other indicators of sentience as well, such as these positive, negative cognitive biases, as well as play-like behavior. Now, importantly, of course, these sentience-like responses might not be limited to bees amongst the insects. There are, of course, welfare implications for other insects as well, especially farmed ones, which are reared and slaughtered by the trillion nowadays to largely feed other livestock, but also supposedly as an alternative to conventional livestock for human consumption. And there are also welfare implications for the control of insects in agricultural settings, where, of course, insects are often, or the plants are sprayed with multiple metric tons of all kinds of different pesticides, which have also the potential to cause quite intense suffering. All right, I thank you very much for your attention. I thank my co-authors that are listed at the bottom here, and I look forward to your questions. Thank you so very much.
Thank you, Lars. That was a fantastic and incredibly inspiring talk. And I can see you've turned on your camera and hopefully your mic too. We've got questions already coming in, so I'll make a start. The first question refers to the play behaviour in the bee. What do you think is the function of play in the bee? Why do you think they do it? And is it for the same reason as vertebrates or for different reasons?
It's a good question, and we don't have a certain answer yet. Of course, in some vertebrates, the function is to practice in a safe setting some kinds of behavior that become later more relevant in life, such as play fighting and object manipulation and so on. That could be the case here as well. So it might be, and indeed Samadhi is investigating whether individuals that have had the opportunity to manipulate balls when they're young might later on be better at flower manipulation, which is often quite a difficult task because flowers are often complex puzzle boxes. If you think of snapdragons, for example, which are quite hard to learn actually to figure out how to manipulate them. So that could be the case, but we're at the beginning of this investigation.
Great, thank you. In regards to the false alarms with the spider study, could a simpler explanation for false alarms be that they err on the side of caution rather than it being a sign of PTSD?
Also, I used the word PTSD deliberately flippantly, but the point there is that, of course, you can't stop feeding when you're a bee and collecting food for the colony. You don't have the luxury to decide, well, I don't want to reject valuable food sources. So the scanning behavior that is increased in all bees that have been subject to this predation threat should allow with reasonable certainty to ascertain whether there is indeed a spider lurking on the flower or not. They usually spend several seconds scanning the flowers. And if they're then abandoning them, that does look very peculiar because, of course, you don't have the opportunity to say, okay, right, I'm not going to visit flowers anymore. You can't. You have to continue in that business and therefore have to make that judgment for every individual flower. Is it safe or not? So you can't err too far on the side of caution because then you or your colony will starve.
Okay, great, thank you. The next question is, thank you for highlighting this topic. I wonder, based on these scientific findings, what your opinions are on animal welfare in beekeeping. What are the biggest animal welfare issues in beekeeping, and what can a beekeeper do in practice to improve welfare for his or her bees?
Well, so it's a good question. Bees, of course, are used for a variety of purposes, and I think there are ways of ethical beekeeping, and to the extent that you're just manufacturing a bit of honey in your backyard, then that can be done with relatively minimal disruptance of bees' lives, and also causing relatively minimal upset and suffering. The spectrum, of course, in how honeybees are used are so they're used in the commercial pollination industry, and at the other end of the spectrum of things that are done to bees, of course, a very large percentage, for example, of North American honeybees are used in migratory beekeeping, where they're shipped to distant regions, shipped all across the continent on trucks, in sealed hives, which are conditions that are very stressful for the bees. And of course, they die in their millions during these excursions, and also while they're then transplanted into these huge almond farms, for example, where they're foraging from flowers that are thickly coated in pesticides. And this industry, this pollination industry, is then absurdly calling for government support and scientist support in finding cures for the bees that are dying under these conditions. And of course, the bees are then also very susceptible to diseases, which makes these migratory beekeepers feed them with all kinds of antibiotics and so on. So it's a health and a welfare disaster. And so I think if we want to put our priorities in to ethical beekeeping, that's where we ought to start.
Great, thank you. Next question is, has your own treatment of bees changed as your research revealed their capabilities?
That's another very good question. Yes. So, I mean, 30 years ago, when I was a PhD student, the question of whether bees might have emotions or sense pain would have been laughed off, or at least be regarded as unscientific. And I did my PhD in an environment where lots of other students worked on, scientists worked on invasive neuroscientific procedures, where bees were often tethered and electrodes implanted in to various parts of their body without any kind of anesthesia. And I have to admit that at the time, even though I didn't use these procedures myself, I also didn't sense that anything was wrong with that. And that perspective has changed over my own work and the insights we have gained into not just intelligent behavior in bees, but also quite likely a form of sentience. And so yes, there has been quite a bit of a perspective change, and we're increasingly trying to make sure our bees are kept in conditions that are conducive to their well-being.
Great, thank you. And I guess a related question, are bees special in the insect world, or would you expect similar behaviors in other insects?
Well, they might be special in some regards in terms of their memory capacity, and so I suspect that these kinds of object manipulation tasks, pulling strings and so on, you might not find them in a cockchafer or a cockroach. But that being said, I mean, if you look at the Drosophila, the fruit fly literature, for example, then fruit flies are used as a model for every other human psychiatric and psychological condition, including depression and anxiety, and so on and so on. Yet, if you then ask the fruit fly researchers, well, do they actually think that these creatures might really be sentient? Then they often shake their head and think that you've gone mad. But of course, the whole point is that if these flies can be used as a credible model for these conditions, then I think to some extent, at least likely that they also suffer from these conditions. They do respond to, let's say, anxiolytics or antidepressants and so on. So I think it is at least likely that some of our findings also extend to other insects, not necessarily all, but some, yes.
So what are the implications of your work, do you think, for animal welfare in general and how we treat bees and insects? Do we need to introduce regulations, guidance or legislation for their care based on their sentience?
I think so. Again, I think it's important to consider where to put our priorities. So some people whom I've talked to are worried that they might no longer be permitted to slap a mosquito who sucks blood on their arm and might transmit a life-threatening disease. And of course, we will not have such laws. First of all, laws are in proportion to what's feasible. And also, of course, you actually have to be realistic that a death that occurs very fast, such as when you slap a mosquito, is not likely to cause much suffering. But I think in the insect feed and food industry, where currently one of the perceived advantage of raising insects for feeding humans and other livestock is, well, there are no ethical concerns, so we can do with them whatever. And I think that needs some careful re-evaluation, and possibly, depending on what people find, also some legal changes for ethical slaughtering methods and so on. Beekeeping I already mentioned. More generally, I mean, I think it's what you do on a daily basis is to some extent a common sense question. So yes, you can slap a mosquito, but the at least once popular children's game of setting ants alight with a magnifying glass, I think is no longer to be encouraged, because it's, I mean, you don't actually learn nothing from it, and it's likely to cause suffering, and so it's not just something that should be taught to children as being a kind of amusing thing to do.
Great. Thank you so much, Lars. A fantastic talk. If there are more questions for Lars, do ask them on the Slack channel, but we will be moving on now to the next speaker. So our next speaker is Maria Jackson, who will be talking to us about welfare of lop-eared and brachycephalic rabbits. Thank you.
Hi, my name's Maria. I'm from the Royal Veterinary College, and today I'm going to be talking about the project I did for my Master of Research, which was partially funded by UFAW, and it was all about whether lop-ear or brachycephalic conformations predispose rabbits to dental disease. So a long time ago, humans came along and we domesticated rabbits, and then started breeding them and selecting for more and more extreme conformations, moving away from the natural wild rabbit. So we wanted to look at whether these selectively bred extreme conformations had led to an increased disease risk, particularly focusing on dental disease. There is some previous evidence suggesting that dental disease is linked to conformation. This study in 2019 found that lop-eared rabbits had 23 times higher odds of developing incisor pathology, 12 times higher odds of molar overgrowth, and 13 times higher odds of molar sharpness. But this was quite a small study of only 30 rabbits from a single rescue centre, so the results may not be generalisable to the whole UK domestic rabbit population. A previous study in 2014 found that brachycephalic rabbits had 3.2 times higher odds of any type of dental disease. But again, this was a reasonably small sample of only 100 rabbits that had dental disease, all taken from a single university hospital in Thailand. So we wanted to further this research on a much larger scale. So why does dental disease actually matter? I think these pictures sum it up pretty well. These rabbits with overgrown teeth, they'll often be unable to eat an appropriate diet or eat an appropriate quantity of food, leading to weight loss and a whole host of comorbidities, or even simply starvation and death if left untreated. It's incredibly painful, affecting the tooth roots themselves, the surrounding alveolar bone, and soft tissue when spurs cause laceration or abscesses like the picture in the middle shows. And this severe pain is usually chronic, and the rabbit will need lifelong treatment. So the aims of our study were as follows. We wanted to estimate the prevalence and incidence of dental disease in rabbits under primary veterinary care in the UK. We also wanted to evaluate whether lop-ear conformation and brachycephalic skull shape are associated with increased odds of developing dental disease. And then with the rabbits that we found that do have dental disease, we wanted to report clinical information about dental cases. So looking at their clinical signs, diagnostic techniques used to diagnose dental disease, the treatment methods used, and also the frequency of death. So this was a VetCompass study, which is essentially an online database holding de-identified electronic patient records from animals that attend over 30% of UK primary care practices. We used a cross-sectional study design and had available to us 160,979 rabbits that were under primary veterinary care in the UK in 2019. We created and tested search terms to identify any possible cases of dental disease, and then the software basically presented me these candidate cases in a random order, and I manually went through, read each electronic patient record and assessed each rabbit for inclusion as a dental case if they met our specified definition. This gave a sample of 2,219 dental cases and 117,890 non-cases. The morphological characteristics were derived from the breed information that we had available on the electronic patient record, and that included the ear type, skull shape, the fur length, fur type, if they had the presence of albinism, and the size of the rabbit, so if they were, say, a dwarf breed. Multivariable binary logistic regression models were used for the risk factor analysis. Now on to the results. We found that the 1 year period prevalence for any type of dental disease affecting any type of teeth in 2019 was 15.4%. And breaking this down by tooth type, we saw that the dental disease affecting cheek teeth was much higher at 13.7% compared to that affecting incisors at 3.1%. The incidence risk for 2019 was also really high at 8.2%, meaning that shockingly around 1 in 12 rabbits will develop dental disease each year. We also looked at the prevalence depending on rabbit breed, and this graph shows the 1 year period prevalence in each breed that had over 20 recorded cases of dental disease. As you can see, the dwarf lops, English lops and Netherland dwarfs did have the highest prevalence of the disease. But it's important to note that the breed itself may not have been the most reliable here. If the breed was originally unknown and just a guess based solely on the rabbit's appearance, then that would have been what was available to us in the electronic patient record. So on to the risk factors for having dental disease. Quite surprisingly, and contrary to our hypotheses and the previous evidence, lop-eared rabbits actually did not have significantly higher odds of dental disease than erect-eared rabbits. The odds ratio was 1.12, but that wasn't actually significant. And then likewise, brachycephalic rabbits also did not have significantly higher odds of dental disease than normocephalic rabbits, with an odds ratio of 1.13 that was also not significant. We did look at other risk factors though and find that some of the others were significant. So one of the risk factors that was actually significant was that as age increased, the odds of the rabbit having dental disease also increased. So those rabbits that were 5 years or older had a much higher chance of having dental issues compared to the younger rabbits. And this supports findings from a number of previous studies too, such as those listed here. Conversely, as the body weight increased, the odds actually decreased, meaning that those rabbits with a really low body weight were more likely to have dental issues. Male rabbits also had higher odds than females, again supporting some of the previous evidence. And also neutered rabbits had higher odds of getting dental disease than their entire counterparts. Additionally, rabbits that had a Rex fur type actually had lower odds of having dental disease than those with what we classified as a sort of standard short hair type coat. So in those 2,219 rabbits that did have dental disease, we assessed the most common clinical signs recorded. We found that just over a quarter of these rabbits had a reduced appetite, and most of the other clinical signs shown in this graph relate to this reduced appetite and gastrointestinal signs. Ocular discharge was also seen in 10.6% of the cases, which has frequently been recorded as the tooth roots can grow and impede on the nasolacrimal duct, causing dacryocystitis. So this isn't really a surprise. The treatment methods that were used actually gave some quite alarming results. 35.5% of the cases had some sort of intraoral dental treatment, which referred to any tooth height reduction or extraction using any means, burring, rasping, clipping, manually or with powered equipment. Shockingly, tooth clipping with nail clippers was still reported to occur, but unfortunately we didn't actually record the number of cases this occurred in. But this is something that has been described as barbaric, and it's considered as malpractice by some because it can result in lacerations of the oral cavity, it can cause shattered teeth, and really extremely painful pulp exposure and necrosis. So it was sad to see that this was still happening. Expanding on this tooth trimming then, this graph shows the proportions of teeth that were trimmed when the rabbit was sedated or under anaesthetic compared to being conscious or awake. Again, shockingly, 6% of rabbits that needed their cheek teeth trimmed had this procedure performed whilst they were awake. And a number of rabbit experts have said that this is not appropriate due to the immense stress the rabbits put under and the possibility of soft tissue trauma being more likely if they suddenly move. The BVZS and RWAF have recently put out a position statement on this, which I do urge you to read if you're interested. But ultimately, I think this really highlights the need for better veterinary education and continuing professional development. As dental disease is so prevalent, it's likely that primary care practitioners will have to treat a rabbit with the disease. So they need to know the appropriate methods to reduce suffering in rabbits, which perhaps they don't currently know. So other welfare impacts from our results were that only 2.2% of these cases had radiography utilised for diagnosis. Again, it's sort of widely known that visual oral examination won't reveal all the tooth structures, and many cases could be missed if radiography isn't being used, so this was quite concerning to see. 34.4% of these rabbits that had dental disease that died in our study had dental disease recorded as a contributory factor for their death. And then on top of that, a further 16.8% died primarily as a result of their dental disease. So basically, quite scarily, over 50% of these cases of dental disease died because of that disease. And this number might even be higher, as so many of these records were incomplete and the rabbit just never came back for a follow-up appointment. So I think this study has shown that dental disease is a massive welfare concern for pet rabbits. It's highly prevalent, it's associated with a number of detrimental clinical signs, and it's a frequent reason for death for over 50% of those rabbits that had dental disease in this study. There are also some really potentially very distressing treatment methods being used out there currently that right now are causing our companion rabbits to suffer. It's important that erect-eared and normocephalic rabbits aren't overlooked in practice when we're conducting routine health assessments, as we've seen now that they have the same risk of having dental disease as their lop-eared and brachycephalic counterparts, so they shouldn't be forgotten about. Hopefully these results can aid in earlier detection of affected rabbits and encourage dental assessments of those that say present with gastrointestinal clinical signs, or those that come in with a low body weight, are of an older age, or are male. And those rabbits that suffer from dental disease need to have their body weight monitored frequently and assisted feeding utilised to prevent these gastrointestinal comorbidities. Future work should look at providing repeated evidence that suggests an absence of an effect to confirm that lop-ears and brachycephaly aren't risk factors for dental disease. We also know that dental disease has a multifactorial etiology, but as it's so highly prevalent, I think more research should focus on rabbits' diet, indoor housing and low vitamin D levels, and how much of an effect these are actually having on rabbit dental disease. And finally, as I mentioned earlier, it's really important that we teach future veterinary professionals the appropriate methods of diagnosis and treatment of dental disease to reduce suffering in these rabbits. So these
Muted, Siobhan.
Thank you. Oh, technology and me, great relationship. Thank you, Maria, for a great talk. We've got some questions already. One of the main ones is, so how do we reduce dental disease in rabbits, would you say?
Well, I think the main thing from the research that we know at the moment is really focusing on their husbandry, specifically the diet. I think it's quite well known now that muesli has been linked with these dental diseases, so really encouraging owners of rabbits or those that are looking at buying rabbits to not feed their rabbits muesli, move on to those extruded pellets or nuggets. And hay is the biggest thing. It should be 80% of their diet anyway, so really making sure that, say, pet shops or places selling these rabbits, or if they're adopting them from rescues, making sure it's very clear that that's their diet that they need, and that will help prevent dental disease.
Why do you think that your results didn't reflect your hypotheses about lop-eared and brachycephalic rabbits?
Yeah, there's a few things that we'd thought about that probably explain this. I think one of the biggest issues, the biggest limitations that we have with this study was that it was using these electronic patient records, and a lot of the rabbits on these records were simply recorded as a domestic rabbit, or just rabbit, and so we ended up with quite a lot of unknowns or unclear breeds, or if we did have a breed, trying to decide whether it usually was brachycephalic or wasn't. So I think that's may have led to some of our more interesting results. We ended up with uncategorized groups being more likely to get dental disease than other groups. It was also, it was a much, it was a very big study. There were a lot of rabbits used in this compared to some of the other previous studies that have suggested this. So I think that's probably the main reason.
Thank you. You mentioned that teeth clipping is a bad treatment option. Is rasping much better, or is it recommended to just remove the teeth?
Again, there's sort of quite mixed opinions on this. Rasping is still seems to be quite commonly used for reducing cheek teeth length, but a lot of people will say that we should try and move against that, or stop doing that, because it can leave quite rough occlusal surfaces on the teeth. It can also be quite dangerous if you slip and sever some arteries instead with that rasp. So I think it's more recommended to look to use burrs to reduce the length of those cheek teeth. Removing incisors is often recommended because they will just keep growing so quickly. They'll need shortening so frequently, and it's quite a stressful procedure. But when it comes to cheek teeth, I think the general consensus is you're less likely to remove them unless they're causing a serious problem, causing abscessation, that kind of thing.
Thank you. We've got another question. Did you capture insurance information? I wonder whether or not using radiography during diagnostics is predominantly due to cost.
Yeah, unfortunately, we didn't actually look at the insurance information, but I do think that is a massive factor in this. Not many rabbits, I can't remember this, I think it's in the PDSA POR report, it does specify how many rabbits are insured at the moment, but it's not a very high number, and I think that will play a major role in what, diagnostics and the treatment methods that are used in these rabbits, and whether some of them go straight for euthanasia purely because they can't afford this lifelong treatment that most of them will need.
Got time for one very quick question. You mentioned that Rex type fur had a lower incidence. Why do you think that might be? Do you have any explanation?
No explanation whatsoever. I trawled through all the papers I could find. The only thing we can think of really is that maybe there's some sort of genetic like cross-linkage. There is some evidence that satin breed guinea pigs have higher instances of kidney issues and other diseases as well. Maybe there is genuinely a link between Rex rabbits and having less dental disease, but I think that definitely needs further work if we're going to be able to support that one.
Great, fantastic. Thank you so much, Maria. We will move on to our next speaker, which is Mike Toscano, who is speaking to us about calcium split diets for laying hens.
Well, thank you for the opportunity to present today. This is a topic that I've been investigating for about 5 years now, so I'm really happy to be sharing the results. And thank you to UFAW for the opportunity to do so. So the topic is keel bone fractures in laying hens and how we can reduce them through a nutritional solution. So the keel bone is an extension of the sternum that's right here that's labeled in blue. And here you see a radiograph of the keel from the side. So the underside should really be almost a straight line, but instead what you can see is throughout the keel all these dislocations and fractures. This is really probably one of the worst keels I've ever seen. But unfortunately we see many birds with this. So there are various reports from various nations, Switzerland, the Netherlands, UK. So it's probably likely that this is a rampant problem across all commercial laying hens. To support that, a recent meta-analysis by Ruffner and Mcculloch in 2020 suggested that there's definitely a variation in terms of the method of assessment, say whether birds are using palpation or radiographs, as well as across housing system, types of hybrids, etc. But as you can see by this graph, with on the y-axis you have fracture prevalence, and on the x-axis you have the week of age, that say by about 50 weeks of age, almost 50% of the birds in the flock have some level of damage, and some have many more. So this is really a major problem across the world for laying hens. Now what's causing it? Well, we don't really know. Several ideas have been put forward. One of the main is that birds are having collisions with the housing furniture. This is the tiers, the nest boxes, the perches. The birds are colliding into these things and then breaking their bones. Similar to if you were riding your bicycle, you fell off and then you had a fracture on your wrist. It could also be the age to first egg, where the bird during rearing is depositing mineral into her bone, making them strong. And if she doesn't have enough time to do that, it could be that the bones would be weak, as well as a genetic predisposition, so like an underlying disease state, as well as there's been some recent data coming out of Denmark that suggested that the structure of the bone, and particularly during the process of egg laying, could lead to fracture. This idea, and they have really good videos showing this, that as the egg passes through, it presses on the gizzard, which then presses upon the tip of the keel, resulting in a fracture at the tip. So these ideas are explored in a recent paper that we published in 2020, and I suggest that if you want to take a look at these ideas, and if you're curious about them, take a look at this paper. But altogether, if we take all these ideas, and obviously the one main is that there is high and persistent egg production, which takes calcium from the bones, this leads to weak and brittle bones. So the bird has, because of these various states, say whether it's this egg production, inactivity, rearing duration, leads to a bird that is weak and brittle in terms of her skeletal structure. When they then has a collision, and be this whether it's external by crashing into things, or internally, say by the pressure of the egg that I mentioned, these collisions are then going to lead to fractures. Now what I mentioned before is about the calcium in the diet supporting the egg shell formation, and this could be a major factor. So let's look at this figure but work backwards, say right to left. So we have an egg, and then that hen will need about 6 grams of calcium per day to support the eggshell formation. She's going to lay about 9 eggs every 10 days. So that calcium is going to come from a pool of calcium in her body that's largely the blood supply. So there are going to be two sources of that calcium, either in the diet or actually also in the bone as a reserve. But now we want the calcium to stay in the bone, because if we take too much, that bone can be brittle and then weak, like I mentioned earlier. So our goal for our study here is to increase the amount of calcium in this pool that comes from the diet and reduce the amount of calcium coming from the bone. Ideally, then more calcium stays in the bone and the bone stays stronger. Now, I should mention this is during a particular phase of the animal's life, during lay. If we look at during when the animals are rearing, when they're very young, it actually goes the other way, where she's not laying eggs, and the calcium pool instead goes to the bone, and then she supports her bone structure development. But once she starts laying, this process somewhat changes, and now she's no longer putting this calcium into the structural bone. So really what we want to focus on is here, that this calcium pool is sourced by the diet and the bone, and ideally more calcium coming from the diet. So our goal for our project is to increase use of dietary calcium while decreasing use of the bone calcium in terms of eggshell formation. So green for diet and red for bone. So to give you a bit more background, one solution could be just to provide more calcium in the diet, but there are limits to what the hen can do physiologically. She needs to actually absorb that calcium. So if you provide so much calcium, it's just going to be lost or excreted, and instead of actually going into the bird. There's also a problem because her kidneys need to process all of that calcium, which can cause damage. So there are physiological limits to what she can absorb. But our idea is going to take advantage of a quirk in her physiology, where the most calcium that she actually needs is during the sleep. And this is where she can increase absorption. So this is well represented here, is that on the y-axis, you have shell formation in grams. And on the x-axis, you have the ovulation in hours. So what you can see is that the largest increase in shell formation is actually during the dark phase when she's asleep. So she actually needs the most calcium while she's asleep. So really our goal, our concept for this project is to actually work with the amount of calcium to get it into her at the right time. So again, looking at this figure in shell formation in grams, this is the same figure I showed before, and the ovulation cycle in hours. Now, if we can imagine the amount of the calcium pool, and this is represented here by this green line, so let's say grams per milliliter, and then you can imagine that at particular feeding times, you would see an increase in that blood calcium that's available. But then once she goes to sleep, and obviously she stops eating, the calcium of the blood calcium available in that pool is going to decrease. So now at a certain point, if she's not able to get enough calcium from the blood, she's going to have to start taking it from the bone. So this would be a standard diet where she's getting basically the same amount of calcium over the 24 hours or for every feeding. But however, if as an alternative option, if we were to instead give her lower amounts of calcium, say at earlier times of the day, and then give her a really big bolus injection just before she goes to sleep, we would see that there's a much higher level in this blood calcium pool. So she's able to maintain a higher amount of calcium available for eggshell formation. And that's what the concept is for this calcium timing effort. Now, what's also important to mention here is that over the 24 hours, in theory, we're not giving her any more calcium. It's just that at certain points of time, she's able to absorb more, and we're trying to target that time. So for our methods, we used 8 pens, 225 LSL hens per pen. And this we use a bow-leg terrace aviary from Mcculloch, and you can see that aviary system here. These are not LSL birds, which would be white, but I think you can get the idea that this is a commercial operation, and it contains 225 hens per pen. We had 2 experimental phases. Phase 1 was 26 to 30 weeks of age, but then because the birds were getting a bit of a diarrhea in relation to the diet, we actually introduced a pause. So from 30 to 34 weeks of age, where all the hens got the controlled diet. We then started a second phase at 34 weeks of age and continued that to 40. So for our diets, over the lighted hours, we would have 6 feedings. And the idea is that those 6 feedings would allow the bird to consume these 6 grams of calcium per day. Now for the calcium timing diet, lights come on at 1 o'clock and say until 1400 hours, she would get 30% of her daily calcium across 4 feedings. But then in the final 3 hours before the dark phase, 1400 to 1700 hours, she would get the remaining 70% of her daily calcium in these final 2 feedings. So we have this 30 to 70% ratio, and what I mentioned is this seemed to be causing some diarrhea. So what we did in phase 2, we adjusted this ratio to 40-60%. The control birds, in contrast, they from 1 to 1700 hours, over these 6 feedings, they received 100% standard feed the entire time. So we have these 2 treatments. In terms of our methods, and I've kept the phases up here just so you can remember roughly when they were. We looked at fractures both in phase 1 and phase 2, and we looked at them in 2 ways. Looking at impact testing, and here we had 40 hens per treatment, and for this we used a device that we designed where we take a bird, we euthanize it, and so the bird is dead when we do this, but we then place it in this device and then drop a weight on it. So, and then we can remove the bird and then we can look for damage. So the idea here is that because we know the energy of the collision, we can actually calculate how likely it is that the bird is to have these experimental fractures. So we'd imagine that birds that have stronger bones would have less experimental damage for a given energy collision. So we would expect that birds from the calcium timing group would have less of this compared to the controls. We also looked at radiographs, like an image I showed before. We had 70 hens per treatment. We can do this in the barn and the birds go right back into the pen. So for this we used a scale like this, where on at the left you have birds with, say, no damage, and on the right you have birds with very severe damage. And then we also had birds anywhere in between. And this is done on a continuous scale, so the bird can be marked what level of damage she has. We also collected data on egg quality, so at a baseline level before the diets were introduced, as well as then 2 times in phase 2. And for this we looked at 20 eggs per treatment, and we examined egg mass, strength, and the shell thickness. We looked at total egg production continuously, and then also a health assessment once in phase 1 and then again in phase 2 for 70 hens per treatment. For this we looked at body mass, feather coverage, and foot health. All data was statistically analyzed in R using linear mixed effects models, as well as a cumulative linked mixed model for impact testing, which used a categorical variable. So first results were impact testing, and it was not what we were hoping to find. We actually saw that the calcium timing birds were 1.23 times more likely to sustain a fracture than a control bird. So if you look at this, the blue represents birds that did not have an experimental fracture, and you can actually see that the calcium timing birds had a lower value. The major was about the same, but the minor was 35% in the calcium timing compared to 20% in the control. So what we were expecting is actually the opposite. The calcium timing bird should have had more no fractures and lesser minor fractures, but this was the opposite from what we had actually found. The radiographs also seem to support that data. On the y-axis you have the severity, and on the x-axis you have the treatment, and we have each health assessment here. What you can see is that the radiograph scores for the calcium timing birds were more severe fractures compared to their controls. In terms of health characteristics, we found that looking at this, so body mass, looking at weight in grams, and on the x-axis we have the two health assessments, we can see that the calcium timing birds were about 100 grams less than their control counterparts. Treatment only was a trend for significance, but it seems like the calcium timing birds had a trend for poor feather coverage compared to the control counterparts. So again, not really what we're hoping to find. Looking at egg mass, we could actually see that at the baseline, we saw no difference. This is egg weight on the y-axis, and on looking at the days of assessment, we could actually see that following the baseline at each time point, the calcium time birds had actually eggs that weighed less than their control counterparts. We also saw a similar pattern in terms of strength, whereas the bird, no difference at baseline, but then the calcium timing birds had eggs that were weaker compared to the control counterparts at the two time points when they're receiving the treatment diets. In terms of total egg production, this was also the opposite of what we had hoped for. You can see here the actual data or the predicted. And the predicted, this is the total number of eggs produced at, say, 3 different time points. And you can see here that the calcium timing birds were producing less than their control counterparts. So as a likely explanation, the results were not what we were hoping for. The birds seemed there was really no benefits to fractures, and they also seemed to reflect their poor health. So we think that the problem was this shift between the calcium poor and the calcium enriched times. So when they were getting this and then all of a sudden switching to this massive calcium bolus, it was just too much a digestive disturbance. So it basically resulted in animals that had diarrhea, they were sick, and sick animals often would have, say, poor production. It's also, calcium is a tightly regulated process, and this shift probably did not fit well with that regulation. So altogether, even if the diet did deliver benefits to the bone, which they didn't, the loss of egg quality and production really was a non-starter. Producers are not going to use a diet if you tell them that the problems with egg quality and production. So going forward, we definitely need a solution for keel bone fractures. There are genetic solutions that are coming, but it's going to likely require 10+ years before these can actually be implemented. Nutritional solutions are great because they can be tweaked and adjusted continually, but we still need to work with these out. For our particular diet, I believe that adjustments can be made to the diet, and ideally we could consider more of a step approach where we gradually introduce the dietary changes and possibly also use a different particle size of calcium. So ideally that shift from the calcium poor to the calcium rich phase is not so steep. With that, I can take any questions.
Great, thank you very much, Mike. I can see you've got your camera turned on, and I finally have my mic turned on this time. So we've just got a couple of questions come in. Could there have been additional calcium loss due to diarrhea, which could have caused the unexpected results?
Yes, I think that's definitely a problem. I guess the problem is that we were looking at an animal that was not in a good state of health. So what was happening gastrointestinally is really up to anyone's idea, but I think my main point was saying about the diarrhea and the poor egg quality is that even if there were some benefits, if the producers can't get good quality eggs, they're producing less eggs, it's not going to be an attractive diet, even if there are some benefits to bone health.
Thank you. Did you consider hen behaviour and hierarchy? Could this have had an impact on who was receiving large amounts of calcium?
Yeah, actually, that's a really good point. It could be, so initially there's a first wave of birds that get it, they get the diet, and it could have been that first wave got more concentration of the diet. But we actually set it so that within that period, there were several refeedings. So we were trying to make certain that even if, say, the first wave got it, the next wave could come through. And also we did verify that even at the end, say, just before they went to bed, when, say, the first wave of birds had gone through, there was still these calcium particulate in the diet. So I don't think that would have been a factor.
Okay, got time for one more quick question. Should producers be encouraged to delay the onset of lay in lieu of other solutions? 10 years seems like a long time to continue with high levels of fractures.
So how you could do that in a way that does not impinge upon their welfare, I'm not really certain. I guess you could make adjustments to diet. You could reduce the amount of calorie restrictions and things, but generally we see, looking at the variation, birds that come into lay later seem to have less keel bone fractures. So I do think that's good, but how to do it, I do not know. So whether it's a genetic solution or management, it's up for grabs, but thank you.
Lots of scope for research. Thanks so much, Mike. I'm sorry we've run out of time, but obviously questions on Slack. Our next speaker is Steve Mcculloch, who's talking to us about what we mean by animal welfare.
Hello, thank you to UFAW for organising this conference and for inviting me to speak today. My name is Stephen Mcculloch. I'm a veterinary surgeon. I am the Senior Lecturer in Human Animal Studies at the University of Winchester in the UK. Relevant to this presentation, I have a degree in philosophy from the University of London and also a PhD from the Royal Vet College in London. To give a quick overview of the presentation, first of all, I'm going to talk about why present on animal welfare. Secondly, I'm going to talk a little bit about the history of animal welfare as a concept and contemporary definitions. Then I'm going to talk about Fraser and Fraser et al.'s descriptions of conceptions of animal welfare. Then I'm going to move on to the 3 circles model of animal welfare and critique that. And finally, I will propose an alternative definition for animal welfare. So why present on this? When I did my PhD work between 2010 and 2015, I was interested in the concept of animal welfare because ultimately policymakers are making policy about the just distribution of goods and costs or harms. And ideally, I argued policymakers should be comparing apples with apples, so human well-being with animal welfare. And so I argued that the conception of animal welfare should be similar to the human definition of well-being, and I'll come back to that later. I haven't published any of that research. I hope to do so this year. But earlier this year, I started working on a report for the Conservative Animal Welfare Foundation looking at public attitudes to animal welfare, which we hope to publish soon. And that touched on some of the different conceptions of animal welfare with different stakeholders. So at a very basic level, what do we mean by animal welfare? We could mean animal well-being, quality of life, happiness, flourishing. I think at the most basic level, though, we can think about a good life for animals. The good life for humans has been a question that philosophers have been interested in for millennia. This terminology, a good life and a life worth living, has become popularised by Fawkes 2009 Farm Animal Welfare in the UK Past, Present and Future report. And I think those two ideas, a good life and a life worth living, also lead to a much broader conception of animal welfare, a more fundamental conception, idealistic if you like, and a narrow one about life worth living for animals. We keep animals, I would argue, in unsatisfactory conditions, and perhaps the life worth living is something to aim for there, but ultimately we should be striving for a good life, and we should bear that in mind with our definitions. A good example of a more expansive, philosophically informed definition of welfare is from Bernie Rowland, who was a philosopher who worked closely with the veterinary department at Colorado State University. And you see here he's concerned about animal welfare and any form of welfare or well-being. You notice that he doesn't actually refer to animals. He includes humans probably in this idea. Having a nature, having a purpose, it's a teleological type of view. and the animal is the constellation of its functions, and he talks about the dogness of the dog or the pigness of the pig, for instance. Moving back to Bramble, which is when animal welfare as a term became really popularised, their conception of welfare related to disapproving of keeping animals in a degree of confinement where those animals couldn't display their natural behaviours. And I think within this definition we have the central idea of animal welfare being related to the nature of the animal and how it adapts to its environment. But also notice that Bramble were quite happy to use the term natural, which has become one of the contentious issues in conceptions of animal welfare. Moving on 50 years or so to today, the modern contemporary definition by the OIE, so the worldwide definition if you like, animal welfare is the physical and mental state of an animal in relation to the conditions it lives and dies. I'd argue that's insufficient from an explanatory point of view, but then the code then sort of supports this with guidance, further guidance, which is mostly scientifically informed. So now I'm going to move on to Fraser et al. From 1997 and Fraser in 2013. And Fraser and his colleagues have done a lot to document various views on conceptions of animal welfare and then propose their own models. And these papers in the book are well worth reading if you haven't done so. And what Fraser and colleagues do, and I'll run through this very quickly because of time, they documented how different commentators, so for example philosophers, writers as well, talked about animal welfare, people who looked after animals, farmers and so on, and then they moved on to looking at how animal researchers also conceived of animal welfare. So here you have a number of conceptions by animal welfare scientists post-Bramble. And what Fraser and colleagues then did was they argued essentially that these different conceptions either are related to a natural-based conception of animal welfare, so I've already mentioned Bramble, I've already mentioned Rollin, or a feelings-based conception, so for example Bentham was a hedonist philosopher in the 18th century, focused on pleasure and pain. And then physical or functional based definitions and people who work closely with animals. And then I think animal welfare scientists tended to use a physical or functional type of definition. So for example, Don Broom talked about animal welfare being a state of an animal with respect to how it copes with its environment. And Fraser and colleagues then documented this, illustrated this with a three-circle model of animal welfare where the physical, functional, naturalness and feelings were overlapping but also distinct. But it's important to realise, I think, that the three circles model I would argue has become quite dominant. You know, you often hear people within education, animal welfare research and policy talking about the three circles model, but Fraser and others actually proposed an alternative model, which I think was more sort of scientific, biologically based on adaptation. So what I'm actually about to critique wasn't the model that Fraser and others proposed, it was one that they sort of documented based on other people's views. But I'd also say that the three circles model became much more widely known compared to this alternative model. And there very quickly is the alternative model. It's just based on adaptations. When an animal is poorly adapted to its environment, it will have welfare problems, which I would, absolutely agree with. Stafflow et al. Wrote an excellent paper in 1996. They looked at all various definitions of animal welfare and proposed that definitions could be considered lexical dictionary type definitions, fairly basic ones for laypersons to understand, and then more theoretical ones, perhaps for researchers, but then also operational ones. And they argued, they talked about the evolution of animal welfare as a concept, but also the erosion of a moral concept, and often the normative elements or the value-based elements were taken out of the concept. And I think you could say that applied to Fraser's model, moving from the 3 circles model to their alternative conception. But moving on to the critique of the 3 circles model, I would argue, first of all, it's got insufficient explanatory power. So what is the cause? What is the relation between these different dimensions or domains? What is the cause and effect, if you like? And then it leads to a kind of relativism, an epistemic relativism. So if you believe in a physical functional sort of model, this can conflict with a more natural-based model. A little bit more about the explanatory power. I think if you thought about animal welfare being a relation between how the animal is adapted to its environment, you can illustrate it in these kinds of ways. I won't go into detail, but you can see here that you've got on the left-hand side the animal and its environment, and then physical and mental well-being on the right-hand side, and then the X represents a component of that. Also, what's the relation between physical and mental? Nature has been particularly contentious. You can think about naturalness of the animal, naturalness of the environment, and so on. Very briefly on nature, I think we've seen Roland earlier talk about nature really relating to the animal, the telos, the purpose of the animal, and this is based on the evolution, both natural and artificial. But also many commentators and researchers think about a natural environment, and this really relates to the indoor and outdoor debate as well. So there are different elements of nature, different ways that we can think about nature, and I think that can be unpacked to help with this broader concept. Just to illustrate the relation between the physical and the mental, scientists are very interested in observable phenomena, objective, quantifiable phenomena, and this leads to focus on physical aspects of welfare, often behavior, but others as well. But how does this relate to the mental domain? And you can see the evolution of a concept here with David Meller's 5 domains approach being developed from the 5 freedoms, and the physical aspects of welfare leading into a mental aspect of welfare. But what about relativism? To illustrate how much of a problem relativism is, so this is essentially different individuals or groups of scientists having different legitimate views about animal welfare and a good life. Fraser actually documented how Australian animal welfare scientists and EU animal welfare scientists both reviewed the literature on sow stalls or gestation crates. The Australian scientists concluded that the sow stalls could meet the welfare needs of the pigs, whereas the EU scientists disagreed with that, and the EU scientists eventually led to a ban or partial ban on sow stalls in the UK. So you can see why this is important, the definition and concept of animal welfare. So what sort of criteria would we have for a definition of animal welfare, an adequate definition of animal welfare? And this is really illustrative. First of all, we shouldn't underdetermine animal welfare, and there's a lot in the literature about, I think, physical and functional indicators in particular leading potentially to underdetermining animal welfare. Necessary and sufficient conditions in an analytical sense, explanatory adequacy, I've talked about causal relations, facilitating scientific investigation, being compatible with leading definitions, but also facilitating comparison with human well-being. So the definition that I used in my 2015 PhD, which I'm sort of coming back to now, is that animal welfare is a state of complete physical health and mental well-being, where the nature of the sentient animal is in harmony with its living and non-living environment, and also its bodily integrity is respected. So you have that central idea of the nature, the relation between the animal itself. I use the term nature to conceive of that, and its environment, the stress on sentience and feelings, I use the term harmony, but you could think about adaptation in a biological sense. Bodily integrity, I think, is very important. Pigs, for example, very widespread to dock pigs' tails, essentially, I would argue, because they're kept in unsatisfactory environments. And this is actually similar to some of the earlier definitions of animal welfare, which were more expansive, and it's quite similar and informed by one by Barry Hughes, a veterinary surgeon. It's also very similar to the World Health Organization definition of human health, which helps with policymakers, and I've mentioned the bodily integrity issue. So the strengths, that central focus on relation, which I think there's a consensus, the relation between the animal and the environment, and either the fit, the adaptation, or the harmony, including both the physical and mental realms, facilitating scientific investigation, facilitating policymakers to compare apples with apples, well-being with well-being, human and non-human animal, and that reference to bodily integrity. So thanks very much for listening. I look forward to your questions.
Thanks very much, Steve. Made my head hurt a little bit. If you could turn your camera on and your mic, hopefully we've got some questions. So the first question is, Marion Dawkins has recently changed her view on animal welfare from being solely to do with feelings to being the health of the animal combined with what the animal wants. How does this fit with your definition?
Yeah, thanks. Good question. First of all, I think Marianne Dawkins did a lot from probably the 90s or so to bring feelings into the concept of animal welfare when it was perhaps being dominated by more physical and functional definitions, likes of Broom. The idea of feelings is, of course, that, you know, ultimately the moral concern relates to feelings. You know, plants have physical health, but we don't have the same moral duties to plants that we do to sentient animals, or as we use the term sentience today, those that can suffer or be happy. So it's interesting that in some ways she's gone back the other way. It doesn't entirely surprise me, because I think that a purely feelings-based definition is problematic. So in terms of how that relates to my, and I shouldn't really call it a new definition, I should call it an alternative definition, because there's nothing that's that original about it really. But it's closer to the conception that I've outlined today, because it includes both physical and mental. So yeah.
Great, thank you. I noticed that you included sentient animal in your definition. Do you think that means that we would have difficulty applying it to animals that we haven't established evidence for sentience of yet?
That's a good question. I mean, I'm a big fan of the precautionary principle, and your question reminds me of some debate that occurred during the passage of the Animal Sentience Bill, and using the term sentient and that evidential issue. I was basically arguing along the lines of, you know, only sentient animals have a welfare, so you don't actually need that term in there anyway. I think I bring in the term sentience just to reinforce the idea that, you know, the animals have feelings. You know, you could argue that that term sentient is superfluous for the reason I've just given. You know, only sentient animals have a welfare. And you could also argue that the term nature is the nature of the animal is superfluous as well. But I just think that focuses attention on the idea, you know, following role in that it's the nature, it's the kind of the it's what the animal is, the ontology of the animal in philosophical terms that basically influence its well-being. In scientific terms, you know, the species influences its welfare. That's why you know, we keep species in different conditions, or species that are adapted to different conditions.
Great. We've got time for one more quick question. Does your definition take into account the dynamic aspect of animal welfare that changes over time?
Yes, I think it probably would, because it's quite a general definition. So, you know, so for example, if the animal's nature, you know, changed over time, then, you know, the definition or the conception would also track that dynamic conception of nature. And I think, you know, the central idea of the relation between the animal and the environment, you know, is within that definition, and that's the key element.
Okay, so we've got 1 minute, so one more really quick question. Would you consider replacing it with they in your definition, even if singular, to avoid referring to sentient animals as it? And would you consider incorporating the concept of dignity as well as respect?
First point, yes, absolutely. That's an error on my part. I think we should move away in our language and discourse from, you know, referring to or using objectifying animals and considering them as subjects. So absolutely, I will redraft that as my first job in a couple of moments. The second question, dignity, the idea of dignity. I will have a look at that. I think dignity is quite a sort of a broad, you know, term. I think it's used in the Swiss Constitution actually, and there's been debate about it related to that. So yeah, I'll have a look at that too. Thanks.
Thank you. So there's still lots of questions we would have liked to ask, but unfortunately we're out of time. Thank you very much to all our speakers in this session, which I think has been a really great session. Look forward to lunch. Hopefully everybody does. We're going to come back again for the next session at 12:30. So do enjoy your lunch break. Thank you.